Yes and no, I think. I mean, I think that I've come to, certainly examining the healthcare reform debate over here, see how horribly centralized and socialistic some healthcare systems really can be, and I remain of that view. I think it's also true that a huge amount of Britain's economic crisis today is because the previous Labour governments poured vast amounts of money into the National Health Service, making it clearly a better service than it was when I grew up. Fewer waiting lists, better outcomes, and bang per buck, way more efficient than the United States system. And I've seen it support my parents, and their experiences with it have been very positive indeed. One also sees that there's just no political constituency whatsoever for getting rid of it. I think there should be a more robust private sector, and I think there should be some further reforms within it. But at this point, I think you have to acknowledge that the NHS is as part of Britain as the BBC. You know, it is one of these national institutions that defines a country. It can be reformed, it should be, but at some point, conservatism requires acquiescence to existing institutions and fiddling with them as long as they're not failing dramatically. So yes, I think I'm much less ideologically opposed to it than I once was. But I think that's probably because the money spent on it was really money we didn't have and pretended we had for a while. And maybe in the next few years when that money really runs out and rationing really kicks in, people will begin to see that its model is unaffordable in the long run.